Perceive, process, perform. Do you need inspiration for your practice? Or do you simply need to practice inspiration? With this series, we aim to do both. Give us 15 minutes and we'll give you practice inspiration. Dr. Chris Ramsey focuses on comprehensive aesthetic and restorative dentistry in his Jupiter, Florida practice. Over the next 15 minutes, Dr. Ramsey will share the latest techniques in body language and what they mean to the success of our practices.
Hi, I'm Dr. Christopher Ramsey, and thank you for having me. Over the next few moments, I am going to cover a great topic that's very near and dear to my heart, which is the art of nonverbal communication. I come from the beautiful town of Jupiter, Florida, which is located in South Florida, which is in northern Palm Beach County. I've had the great opportunity, like many of you, over the last decade to tour the country and other countries doing topics such as sustainable aesthetics. Now, like you, much of the dentistry that we provide is all about form, function, and the ability to pick and choose the correct materials to get a great success within our dentistry. And it's been an honor and privilege to be able to talk about interdisciplinary care all over the country, utilizing some of the best specialists, best materials, and best philosophies to get the results that we want. One of the things that's near and dear to me also is implant aesthetics. I've loved doing implant dentistry like many of you, and that's also been a topic that's been near and dear to my heart. But regardless of the results that we can get, one of the things that often happens is the fact that we have a large decision-making process, and from region to region, person to person, a lot of that can change on different philosophies. Hopefully, regardless of your philosophy, we're getting to the best final result that we can. But when it comes to the decision-making process, I really realized many years ago, a lot of us have really been able to master what's going on here and here. As a dentist, we concentrate on the mouth and the joint. But for me, the decision-making process many years ago, I quickly realized it's not what's going on here as much as what's going on here. Many years ago, I really became enamored with the fact that people make decisions, and what I quickly learned is a lot of humans make decisions very much the same way. How they're going to purchase, why they're going to purchase. A lot of the decisions they make have a lot to go into figuring out what is their drivers and what are some of their barriers. And that's what we're here to talk to you about today. So we're going to jump right into it. And the brain, when we talk about the brain, today you're going to hear me talking about a simple part known as the limbic part of the brain. Now, the limbic part of the brain is what we know as the honest part of the brain. The honest part of the brain is what typically controls what we know as flight, fight, or freeze syndrome. Our whole entire lives we've grown up, we've heard those terms. That is all controlled by the limbic part of the brain. Now, understand what that means. That means when something scares you and those goosebumps stand up, or your hair on the back of your neck stands up, or you get the goosebumps, what does that mean? That means that's a non-controllable response. Your body does that out of fear. Subconsciously, you cannot control that. That is the limbic part of your brain that's doing that. And that's the part we're going to focus on today. Because the limbic part of the brain, being the honest part of the brain, is basically what controls the concept of body language, and that's what we're here today to talk to you about. When it comes to body language, simply put, Webster's Dictionary is going to tell you it's the gestures, movements, and mannerisms by which a person or an animal will communicate. But it's so much more than that when we start talking about communicating with our patients and or our team members. And so as we go through this today, understand that the techniques I'm showing you today in just a few moments will work whether you're discussing something with a team member, a family member, or even more importantly, your patients as you're trying to get them to choose optimal care. So body language, the first thing we have to be okay with is a simple fact. Women are better at it than men. Women will have what's known as women's intuition. Men, unfortunately, all we have is a hunch or a gut feeling. Now, this is science because Harvard University actually showed in a great study that women are almost twice as good as men when it comes to reading situations. So ladies, right off the bat, I have to tell you, congratulations, you are better at it than we are. But this is a science that can be learned by many, and I think it's extremely important to learn about it in dentistry because if you learn these techniques, you will see things that you've never seen before, and the conversations will change dramatically. And no longer will you be asking the question, why have they not accepted treatment with me? Now you'll be saying, wow, I can't believe how much more I'm getting yes. I'm be able to guide those conversations down the path that allows someone to choose me to do their optimal care. So let's talk about the two things. Body language breaks down into pacifying behaviors and intention cues. Now, an intention cue is simply put, it's a behavior that reveals what a person is about to do, allowing the observer to prepare for that action. And what do I mean by that? That's simply put, if you're lecturing to a group and you see someone start to kind of maybe raise their hand, you know clearly that they're about to ask a question. That's what an intention cue is. But today, we are going to do more about what's called pacifying behaviors. So here's just a few: stroking the face, playing with your hair, rubbing your cheek, exhaling slowly, puffing your cheeks out, massaging the neck. These are all things that are done for one reason. Most of these things, especially the touching of the face and the rubbing of the neck, these release endorphins which help calm you down. So I'm going to give you some insight real quickly. You're talking to a male patient or team member or family member. Men will do these three things typically. They'll touch their face, they'll rub their neck, and they'll do this. Now, these are important signs because what happens is when you're discussing treatment with somebody, you'll say, "Mr. Jones, we're going to take out your lower left molar." And he goes, "Okay." Instantly, I know Mr. Jones may have a fear of surgery, and then it allows me to start guiding the path differently. Or maybe you slid a treatment plan across the desk, and they're looking at it, and you notice they look down at the fee, and they go, "Okay." And they look at it, instantly I know there may be an issue that's based on monetary. So quickly, I want to relate these to you because also with females, you need to know what they'll do. A lot of times they will cross their hands and they will touch the nape of their neck. If they have jewelry, they'll play with the jewelry on their neck, or they'll play with their hair as they're talking like this. These are pacifying behaviors. And so when we look at these things, we have to look at them in context, and we'll cover that right now. What you need to know is when it comes to reading body language, your body parts are more truthful the farther you get away from your brain. Why is that important? Because most people are looking at the face, and the face is the worst thing to read body language. To give you an example, when you were a child, your mother would take you to say, maybe you see your grandmother, and she said, "Now when we get to your grandmother's house, you do me a favor, you smile and tell her how great it is to see her." We've been asked to lie with our face since we were a kid. And so truthfully, the face is a terrible place to look if you're trying to read someone accurately. Hence, that's the term that we know, often known as the poker face. So when we look at it, there's three things I want to make sure I get across to you: how to read things accurately. When we look at a way to read accurately, you've got to read your gestures in clusters, meaning multiple things that will occur. They also have to all be congruent. And lastly, you got to read the gestures in context. Now, context is extremely important because often people will say, "Oh, I know about body language. That means someone's standing like this," like you see the picture there. And people say, "That means they're defensive." Now, the truth is, arms crossed and hands clenched, that is true. That is a hostile and defensive posture. But if you walked into a room and saw someone standing like this, you could misread that. Simply, they may be standing like that because the room is cold. So we want to be able to read those in textures. So anytime I meet somebody for the first time, especially a patient, I will meet them and create a baseline. However they are right now, that's my baseline. And then I start to look for things in context when I'm talking about it. Now, ironically, when you look at somebody standing like this, you do need to know the top three. Because the top three reasons someone stands like this is when they're at the doctor's office, the dentist's office, or they're a first-time traveler. So you may see multiple patients in your operatory like this. Don't take offense to it. It's just human nature for us to do, whether we're at the doctor's, dentist, or first-time traveling. But one thing you have to know with arms crossed, it's a topic that comes up a lot. No matter what reason the arms are crossed, you have to know it's creating a barrier. And if it creates a barrier, you are actually going to find a person will actually retain 38% less information just with their hands crossed. Why is this important? Because you've decided to consult, let's say, Mrs. Jones, and now she comes back for a second consult with her husband, Mr. Jones. They come into your operatory. She's hearing it for the second time, but you walk in and he's sitting like this. Now, whether he's sitting like that because he's cold or defensive, regardless, the hands always follow the brain. And so what we want to do is we want to get Mr. Jones' hands to uncross. It's extremely important. Remember, if his hands are crossed, less information will be there. So easy way is often I will hand Mr. Jones a model or something that gets him to uncross his hands. As soon as I do that, almost 40% of the information I'm going to give, now he will be able to absorb. Extremely important. So we know there's a big hand-to-brain connection. Remember these things when we were younger. Hear no evil, see no evil, speak no evil. Well, there's a lot to be said when it comes to these hand-to-face gestures. So I'm going to give you some examples. When we put our hands to our face, often in context, that will often be very similar to what we know as speak no evil. When you were a child, you would cover your mouth when you told a lie. You'd be like, you're telling a lie. Well, we still do that as an adult, but we're able to control it. But subconsciously, that limbic part of the brain will bring the hands up to the mouth. Typically, that means, oh, I need to stop saying this. Whatever I'm saying may not be truthful or 100% accurate. So I look for things in context where someone might be bringing their hands up to their face. The other one is interesting. People often want to know about people that are not being truthful or deceitful. Well, there's a thing here where people will often rub their nose. So if they're rubbing their nose in contents, especially when I've asked somebody, well, what dentist were you seeing before? And they say, well, I don't really remember what his name was. Instantly, I think, I'm not sure if that's accurate, because what happens is when you're not being truthful, there is actually a catecholamine release. And that's the reason you're touching your nose. Under MRI, they've actually seen the nose will expand, and what we often call is the Pinocchio effect. So the nose enlarges actually because of that catecholamine release, and often that has to do with people not being truthful. How about the eye rub? The eye rub goes back to see no evil. The eye rub is often, you'll talk to someone and they'll say, well, I don't think this was done correctly, or I think that I needed to, I think I saw 3 doctors before you. Maybe it's true. And again, is it in context? Do they have something in their eye, or do you find that they're touching their nose and rubbing their eye during the conversation? So it just helps guide the conversation down the way you might want to take it to see what might be truthful, what might be deceitful. So when we also look at the ear rub is extremely common because it's an anxiety-driven thing. So when I'm talking to someone, often if they're touching their ear, we know it's the ear grab, which can be based on anxiety and what's going on in their brain. And then lastly, when we look at this, what you need to understand is the feet and legs are the most accurate parts of body language because they're the furthest from the brain. Remember, the farther you get away from the brain, the more accurate the body parts are. In fact, I often tell people, rarely will you see someone depressed with really happy feet. Their feet will kind of drag along, which dictates the rest of their body. And so remember, the feet and legs will be a way to understand what's going on in someone's brain. Now, why do I say that? Because a lot of times we sit down to do consults with people. And when we look at this, we've seen people in a starter's position where they sit down and they look like they're about to take off running. That's a good way because a lot of times they don't even realize they're sitting like this. But what's happening subconscious? The limbic part of the brain is saying, I want to leave. I've trained a lot of my team members to say, when you see positions like this, it's important to understand maybe now is not the time to get really in-depth about their treatment because subconsciously they want to leave as soon as possible. I hope you can see my whole body because men typically will stand like this. And often when they're at a party, they'll stand like this. And the non-dominant leg, almost 90% of the time, if you look at that non-dominant leg, it will almost always point to an exit. I do that always when I'm treating people. And we start having a conversation, then they rotate to get comfortable and they put this non-dominant leg out. It starts pointing towards the exit door. I know subconsciously they're thinking, I want to get out of here. And we stop the conversation. So, how about when they're in the dental chair? Well, there's a great study with 319 patients. 88% of your patients, you will walk in and their ankles will be locked in the dental chair. But it's only 68% if it's a checkup. What does that mean? I know when I walk into the room and I know their legs are crossed, it's the mental equivalent to biting your lip. All it means is they're feeling some negative emotion. So a lot of times I get them to uncross their legs. Uncrossing their legs, again, if your body parts do what they're supposed to, the brain will follow. So lowering and hiding status. What's important here is there's a known superior subordinate position. Everything that's related to being higher than someone else is superiority. In fact, if we look at these sayings, your highness, low life, looked down on you, you fell short, upper class, high horse, rise to the occasion, high and mighty, these are all based on body language. Because what we often know is the higher your stature, the more important you're perceived. Look at the Olympics. The guy who wins the gold medal stands higher than everyone else. If you buy a condominium, where's the most prestigious place to be? The highest part, which is the penthouse. So there is a superiority issue here. Well, we have to know that because how do you meet your patients? I tell everyone as much as I can on the road, when you're meeting a patient, I never want to meet them lying down. As a male doctor, I like to meet my patients. If I'm meeting a man, I sit eye to eye. If I'm sitting eye to eye, I also sit eye to eye, knee to knee, and heart to heart. It's the best way to have a consult. If I meet a female patient, I lower myself about 6 inches. This gets a female patient who's new to me the opportunity to look down on me, not vice versa. The worst thing we could do is meet a patient lying down or look down on a new patient. Subconsciously, it's very intrusive. If you're a female doctor, I think it's extremely important to always lower yourself, but sit eye to eye with a male patient, never lower. I love interdisciplinary care. I've had the opportunity, as I've said, to lecture all over the globe about this concept. And there are many great lecturers out there who cover this topic very, very well. And it's very near and dear to my heart, utilizing specialists and doing great quality care. And when we take into account all the materials, equipment, technology, techniques, protocols, we basically want to do one thing. We want to be more efficient and we want to produce better quality dentistry. And we can all do that very well. But before we get into here, we have to know what's going on here. I want to end with one simple concept. In 1943, Abraham Maslow created what we know as the Maslow's hierarchy of needs. And it's an interesting thing because the first two are very important. Psychological needs, you need air, water, clothing, security, financial, physical security. Those are the two first ones. But if you look at the third one, it's love and belonging. People need to feel they're part of a system. They're loved, they're understood. And this takes precedence over self-esteem. This takes precedence over self-actualization. The third thing that all humans, they want to be loved and belonged. The best way before we jump into the mouth or jump into the joint or jump into dentistry is make sure that we're able to understand what's going on here. Because if we can get in here, this part will follow and you'll be able to do the dentistry that you've always wanted to do. I'm Dr. Christopher Ramsey. I appreciate the time here today. Thank you to the Seattle Study Club. I look forward to meeting all of you soon.